Many U.S. leaders are struggling to keep the transmission of the coronavirus at bay as Americans push to return to life as they used to know it, maybe a more normal life. The country's top infectious disease expert, though, Dr. Anthony Fauci, says that this kind of spread that we are experiencing is very, very difficult to contain. Since February, the country has seen more than 4.7 million people become infected. Nearly 156,000 lives have been lost. To help curb the spread of the disease, the mayor of Houston, Texas, is taking a controversial approach. Yesterday, he warned that those who continue to disobey a statewide mask mandate will be hit with a $250 fine. Recent large gatherings like this rave under a bridge in New York over the weekend are raising alarms for health experts. And as CBS News correspondent David Begnaud reports, it's not only those who attend those gatherings and events who could be in danger.
Over the last 24 hours, the state of Florida reported its lowest number of new coronavirus cases since the end of June. But there's a big but here. Almost all of the testing sites here in the state of Florida have been closed for the last 4 or 5 days because of Tropical Storm Isaias. Now they're opening back up, including the one here behind me in Miami Beach. So over the next coming days, we'll get a more accurate assessment of how many infections there are here in the state of Florida. Meanwhile, here's what's happening elsewhere in the country.
In many, many parts of the country, Mississippi, Missouri, Illinois, Ohio, the number of cases are rising. And
this is Dr. Ashish Jha, director of the Harvard Global Health Institute. He is warning that unless attitudes on masks and public health rules change, no region of the country is going to be safe from new outbreaks.
Right now, across much of the Rust Belt, I don't expect schools to be able to open or certainly stay open for any extended period of time because their virus levels are too high.
In 32 states and Puerto Rico, the percent of positive tests is still above the recommended level for reopenings. Handling it properly means wearing masks and avoiding crowds, indoors and out. But still, gatherings like this house party near Beverly Hills keep happening.
It is a public health issue for everybody, no matter how healthy or young you might think you are.
Molly Grantham says her entire family caught the virus, including her 2 young kids and her brand new baby boy, Hobie.
How's the baby?
Thank God, okay. I've studied his breathing like a hawk. It's been really nerve-wracking because you don't really know what you're studying, right?
Once her family recovered, Molly decided to share her story online.
Welcome, I'm Molly Grantham.
Molly is no stranger to storytelling. She's an anchor at WBTV, the CBS affiliate in Charlotte, North Carolina. She's even covered the virus. But going through it showed her there was a lot she still didn't know.
I didn't know that you didn't have to have a fever. I didn't know kids were definitely susceptible. My God, if I could learn something, I felt like maybe someone else could learn something from our story once I knew we were safe to tell it.
Molly says baby Hobie was the youngest presumed positive case in Mecklenburg County, which is the Charlotte area where they live in North Carolina. She says they may have gotten the virus from her in-laws who had come from out of town to help, but her husband thinks he got it from the cafeteria in the hospital while Molly was in there delivering baby Hobie. The bottom line is, after everything they have been through, they feel like, you might say, awareness ambassadors, trying to share their story with anybody who's willing to listen to what it's like to have this virus. Anne-Marie?
All right, David, thank you. I want to bring in New York pediatrician Dr. Dyan Hes to talk a little bit more about, our latest developments. Doctor, a lot of colleges are now starting to prepare to open. Some of them are going to be offering in-person classes or have people in dorm rooms, and they're trying what they can to social distance in a dorm room. I can't imagine that's very successful. But Dr. Anthony Fauci said the key to controlling the virus on college campuses is going to be regular testing. Do you agree with that? And I'm wondering if we even have the capability. I don't know what it's like on college campuses or in college towns, but I know here in Philadelphia, the turnaround time for, the result for a test, if you're not showing symptoms, is, still minimum about a week.
Yeah, I completely agree. I mean, Dr. Fauci is brilliant and his ideals are great, but the truth of the matter is that I can tell you now that there's back orders on reagents. So even if the doctors and the clinics are buying the Abbott rapid, ID test or other rapid company tests, we can't even get reagents sometimes to run the tests. So you can't do the rapids. And then when it's sent to a lab, if you're asymptomatic and not going pre-surgical, it might take 14 days to get your test back. And that's like the cat is out of the bag already. that time.
Yeah, indeed. Here's something new. State of Pennsylvania, where I live, announced that it's temporarily suspending the requirements for childhood immunizations. I think we talked about this before. I know we've talked about this on CBSN, that there was going to be a concern that, parents didn't want to take their kids into any sort of medical environment with this whole coronavirus thing sort of flying around. And so they were going to avoid immunizing their kids at the regular times. What's your take on that? Schools are reopening. I know my kid's school is offering both virtual and 5 days a week in class. So kids are going to go back to class.
Yeah, I just saw that when you sent that to me this morning. It's so disappointing because I have tons of friends who are doctors in Pennsylvania, and they've been open. So it's a lot of like spreading this mixed message to parents. You're saying, oh, you can go back unvaccinated because maybe it's like, it doesn't even make sense. So it's dangerous to go to the doctor's office, but you can go back to school.
Right.
So, I mean,
right.
I know most of my friends are empty. Our offices are empty. It's not that you can't get an appointment. It's that their patients are afraid to come. So you're telling your patients or your citizens in Philadelphia and Pennsylvania, oh, go to school, but don't go to your doctor's office to get the vaccines. Now, what's going to happen if we have an outbreak of measles or pertussis, or polio? This is just going to be another layer on top of COVID. And it's also flu season, and we need these kids to get the flu vaccine for school. And now they're getting this 2-month leeway. So it's kind of saying to the people in Pennsylvania, like, vaccines really are important right now during COVID. And we know they're super important because we're going to have such a mess when these kids are having a fever. Now, I don't want to have to rule out meningitis because of measles or mumps. It's just craziness.
Yeah, I think you're right, especially with sort of fever being a symptom of the coronavirus, but also a symptom of so many other things, like, whether it's just the flu or something else. How will we determine what it is that's making a child sick if they're not getting protected? So another question about kids. There's some new studies out there that are suggesting that children 5 years old and younger may be able to spread the virus as effectively as adults. What do we know about these studies?
Well, these are very small studies, and I know that the studies show that they carried a high rate of concentration of the virus in their nasopharynx, but I'm not convinced that they are super spreaders or spreading as much as adults because I think a lot of these families, they lived like in Italy where they did it. I think they were household contacts. So the child had it and lived with their grandparents. And it was before kids were masking to go to school. So listen, we've said all along, kids can get this virus and they're asymptomatic. But I don't think from these two small studies that we can make like a huge generalization by far. I think what studies have, what we're seeing in other countries and in the United States, I have to tell you, my daughter went to lacrosse camp that was outdoors. I know tons of doctors who send their kids and friends that send their kids to camp. Daycare has been running in New York. The JCC in Atlanta is open and there's no outbreaks. So if the teachers are masked and the smallest kids are not, there are no outbreaks. They've been really good.
Okay.
I feel like the media a little bit sometimes is too negative because there have been success stories. There have been many, many success stories. And I think I'm going to write a paper about it because I feel like we need to hear that kids can go back to school safely.
I think that's really, really good. And I think that, the conversation that I've been having with people about, maybe going to the beach versus going to a doctor's office versus, one business compared to another is that, some places have suggested protocol and some places have required protocol. And where the protocol is just suggested, then you can't really expect everyone to mask up all the time or keep their distance. But if businesses want to stay open, they have to, make sure that they're complying with all the protocol. And so even though you may be physically closer to another individual, if they're doing the right things, then you may be actually more protected than you are in other situations where it's all willy-nilly and, wear a mask if you want, or if you feel uncomfortable, you don't have to.
Right. And just remember,
here's
now,
another.
Sorry.
Mm-hmm.
No, I was going to say that when these studies were done, this was from the epidemic in March. So if you had a grandparent living in your house, you weren't told to wear a mask at home. But now we know that if you have an elderly grandparent and you're coming and going or going to school, that child should wear a mask when they're around that grandparent.
Oh, see, that's all good information. Okay, here's another one. The other day we had a whole conversation about like the face shields. I know some people have chosen to wear face shields because they can see out of them, and now it's turning out that the face shields may not be as good as the masks. I was speaking to the makeup artists, and some of these production companies are starting back up again. She got a whole list of things that are required if you want to work as a makeup artist, and one of the things they said, not a face shield, goggles. You have to wear goggles and a mask. And now we're hearing Anthony Fauci bring up the idea that maybe we should be wearing goggles. Can you get the coronavirus through your eyes?
I don't know of anybody who has, but I do know that people they believe they've contacted it through flying. And I think that most people are masked when flying. So if they did contact it, they wonder, like there was a whole bunch of doctors who flew back to California, and one doctor swears that every part of his body was protected but his eyes. I know a doctor that flew from Australia and was tested negative before he flew, and 4 days later he got COVID, and he's actually intubated. I don't know him, I know of him, in New York, and they believe that he caught it on the flight. So maybe his eyes weren't protected. No, I mean, there's so many open-ended questions, and we want to give a right answer. I can tell you that it's hard to get goggles. That is a real problem. I mean, it's going to be hard to get goggles for smaller kids. I wear my glasses. I wear a face mask. Even the goggles that I got are not like sealed. They're not like a scuba gear. They're just like, they almost look like clear glasses. They're hard to find, and they're very expensive.
That is the thing about this virus, doctor, is that there are just so many unknowns that just sticking to the basics, trying to limit your exposure. You can be tested all day long. The idea and identifying someone who's contracted the virus is very important. But, I don't want to contract the virus. I don't want a positive test. I don't want a test. I don't want to be exposed, period. And because we really don't know all the different ways that one can contract the virus, what we do know is to keep our distance.
Exactly. Yeah. And we know
sorry,
that
doctor.
for the most part, masks work.
There you go. Mask, social distancing, wash your hands, all the basics. Dr. Diane Hess, thank you so much.
All right. Take care. Be safe.